Kim Fong, welcome to Geological Shop Talk, our sports medicine series.
Thank you, Michael. I'm excited to be here.
I'm happy to have you too. Today, we're going to be talking about kinetic chains, channel pathways. Movement is medicine.
Wonderful. Very dear to my heart.
I'm sorry, say that again?
It's very dear to my heart.
Totally dear to your heart. Now, how did movement as medicine become dear to your heart?
I think just my background as a physical therapist. I started, went to school. I was a physical therapist. Also, my specialty at the time was pediatric physical therapy. So what was lovely about that is you really observing children in their most primal states, right? So it's talking about developmental movements, and you watch them and how to get them to do exercises. You can't just tell them, lift your legs, do this. You really have to kind of create a setting for them and really observe all these different developmental movements. So with that, I just really was very fascinated by all different types of movements and being able to observe normal movement and abnormal movement when a child is walking, right? And during, you know, influx. So after that, I was treating patients for a while in the pediatric setting, but then I feel like I needed some adult experience. I was working in the orthopedic setting, so I got to work with adult bodies. But then afterwards, I just kept on going on and decided to go into acupuncture school upon the guidance of my father because he said that's how they treat integratively in China using physical therapy and acupuncture. So going back to grad school again, and when I was in acupuncture school, again, the movement came into play with whether it's Tuina, Tai Chi, Qigong. My school was great because they definitely encourage us to look into more alternative exercises, like whether it's Feldenkrais. So again, movement came into play with that. So I was always fascinated by just movement and how a body responds to it.
That is so fascinating. Your earlier work, pediatric physical therapy, and at a very, very profound developmental time in a human life to watch how children began to create movement in their body.
Yes,
You got to see what normal movement was, you got to see what abnormal movement was, but beyond that, to see developmentally how this stuff happens.
yes. So I think that is very helpful in the setup of I guess, my understanding in physical therapy, kinesiology, movement analysis. So I think in my eye, that's how it's trained. If I see, I could really just, it's funny when I walk around or if I'm running, I'm always observing people's movement patterns. So I'm a runner, so we do some trail run or I'm in races, I'm running like, oh my gosh, this person didn't knee or they're in so much pronation. They really need to like my brain goes there immediately.
Wow. So you are one of these practitioners at this point. I mean, maybe you had some innate capacity, but it sounds like you have trained yourself in some ways to really use those observational skills
Yes.
to see what's going on with somebody. You're looking at how they stand, what their gait is, how they move, how they don't move.
hmm
For people that are listening to this, have you got some thoughts on how to develop those kind of observational skills?
Sure. I feel that not everyone have to have similar backgrounds. Like I have my formal physical therapy training. However, I think a big part of it is just observing a person. Like in Chinese medicine and in Western medicine. In Chinese medicine, we talk about the first thing you do in your evaluation is observing the patients, whether observing their shen, just looking at their color, right? Physical therapy, you just look for body asymmetry. So observing is so important, and also like observing how they speak, their intonation and their mood, their emotions, just observing, take it all in. I always say do not pass judgment when a person first steps into your treatment room.
Mm,
I just sit there. I just let them tell me stories. Tell me stories. They go on about their pain, then they may go off in a tangent about maybe they fell a long time ago, and then, or maybe they have some, oh, I remember now, like when I was 3 years old, I was on a bike and I fell and this and that. So I take all that information in because it will give you a lot of information. And you just have to make relationships of it and connect the dots for them.
wow. Kim, I love this because it's something I've just noticed in my practice. I don't know, past bit of time, whatever that is that it's so easy for my mind to go looking for pathology. It's so easy to go look for where the problem is because I was trained to look for pathology. Over time, I have also learned to listen to what else might be there,
Hmm.
but mainly because I couldn't find the pathology. So, okay, now I just have to wait and be patient, like going fishing,
Correct. Correct.
and wait until they tell me what's wrong. But I've started to come to this on my own, and so I'm very happy to hear you say this and talk about this, that you can just be with somebody without judging
Hmm.
and kind of let it wash over you, let the whole gestalt of who they are, how they move,
Yes.
what's going on, just let it in without trying to find the problem first.
Exactly. Yeah. You don't have to. I think sometimes that's why I don't know whether it is a pro or con for me. A lot of patients may ask or they may give me a diagnosis or they want to know what's the diagnosis, right? But it could be a number of things. There are a lot of patterns of disharmonies. There are a lot of muscle imbalances, right? So they want a diagnosis. I may explain to them whether it is maybe a tendonitis issue, but there's so much involved, but they want a label. I don't like to label anything or assign anything because you're working on the whole body. And there's a lot if I have to label everything because I could go, well, it actually started from this, that, and that, but I'll give them a general label to or their information about their diagnosis so they have a understanding. Some people just need that little clear understanding, which is okay. So I will offer that to them, but slowly with each treatment I would try to educate them why it came to this point because there may be a lot of things, again talking about your developmental patterns, your abnormal patterning, and your dysfunctions and muscular imbalances or emotional holding patterns. How did you get to where you are now? And how could we slowly unravel it all for you so you have a better understanding of how to work with yourself? Because I always explain to them, I'm here to guide you and to help you, right? First, eliminate the pain, right? The branch treatment before we really kind of go deep dive into the root, but I'm not with you 24/7. And I think that's where the movement piece is so important to educate a patient on how to learn to start moving your body accurately, wisely, and safely.
Okay, there's a lot here, and I want to get into helping them to learn how to move their body accurately, wisely, safely.
Yes.
That, yeah, we're gonna come back to that in just a second. The thing that you had to say about diagnosis, I see this as well myself. People just want a label, and then they just hold on to it.
Yes.
And it sounds like you are giving them a kind of a placeholder sort of label so that it's malleable, so that they can somehow change beyond that label that they have.
Yeah, so there's not attachment to that, right? So it's reframing their minds as far as like, I have herniated disc. I will never be able to do this again. Not true. You may have herniated disc or you may have some kind of lumbar dysfunction, but you'll be able to do, you may be able to golf. You could do a lot of things. So I've treated patients with really old injuries or cervical fusion for like 20 years. They said, I have cervical fusion. I could never turn my neck again. We started treating, they're like, oh my goodness, I never thought I would have this much range of motion again and do all the things I can. I said, yeah, nothing's concrete, right? If we could try to change it, we would try to change it.
How do you open up their thinking to let in that possibility? I mean, I have the same thing. People come in and they talk about the herniated disc or when they pause for dramatic effect, degenerative disc disease, or my very, very favorite.
Yeah. Because they're so attached to it. They're very attached to it.
They're so attached to it, but here's my favorite one: bone on bone. They're always like this. It's
Bone on bone.
bone on bone. There's always, there's this dramatic affect that goes with it. How do you help people to hold that a little more loosely?
Well, I think partially people are emotionally attached to their body, their health, and just maybe the aging process, right? So I think what I'm known to be is like the biggest cheerleader. And I'm always like don't worry about it. We could get more. And they're like, do you think so? And instill that trust, right? Because, and this is part of having experience too. You don't want to give people false hope. So you may say, with your experience, you say, well, I have treated this type of patient. I know I could get them to this level, or I have done this before, or feel like your potential, we could get to this point. So you want to give them realistic hope and be their biggest cheerleader because a big part of it is fear. They don't know, right? They're injured. So they don't want to get hurt again, or they never want to be in that place again. But if you know you could help them, guide them there, right? Again, education piece of, okay, I can help you eliminate your pain, but you cannot keep doing this type of stuff because you're going to have pain again. So let me teach you better ways to go about gardening or doing whatever else you like to do, right? And with that, we could get you to a place that is manageable. So again, also realistic expectations. So a lot of education and just instilling their trust in you.
Sounds like you open up a little possibility, you don't overpromise, and then you help deliver something that's a little bit beyond what they had before. So now they realize, oh, it's not exactly the way I thought it was.
Exactly.
That sounds really fun. That sounds like a great way to go through the day. Cool. What kind of methods do you use? I know you're a PT. I know you're also an acupuncturist. You're bilingual,
Yes.
so to speak.
A little trilingual.
Maybe a little trilingual.
Yep, I love Spanish. I like my Spanish speaking patients when they come in. And again, having that trust. When they come in, they're trying to communicate with me in English. And once I kind of break out my little Brooklyn Spanish, and they're like, they get so excited. And I said, because again, that level of trust, like I understand them, or they may be able to understand me a little bit more.
And you get to practice.
I get to practice. I love speaking Spanish.
My God, that's so fun. So speaking of practicing, what kind of methods do you like to use? Do you use a bit of PT, a bit of acupuncture? How do you blend these together? What do you do?
I think it's definitely integrative. I don't know whether it's a 50-50, but in with my view, my angle when I come in, we talk about observing the patient, I will probably put on my PT hat at times and look at their range of motion, or I may put on my Acu hat and go, oh, look at the little channel obstruction, maybe whether it is any type of holding patterns or, different disharmony that's happening with them. And then the evaluation process, especially for any type of pain orthopedic cases, I am a firm believer in palpation, touching the patient. I think it's very, very important to put your hands on a patient because I don't think patients get that physical contact much. One of their biggest complaints when they go to the doctors, oftentimes they go, they didn't even touch me. How would they know where it hurt? They just gave me this drug, right? They don't know where my pain is. So I think when you touch a patient, you can identify their pain points or their restricted range of motion, whatever it may be. It validates them, their pain, right? So I always tease them. I said, good. Oh, look how tight you are. This is happening. So you're not imagining it. They're like, yeah. Sometimes they don't know. And in physical therapy, we do talk about referred pain and acupuncture as well. So if there's obstruction in the channels, it may affect other areas, right? So again, I'm integrating those two thoughts there. And so I feel like palpation, touching patient, observing their movement is very important. So that's my approach. And from that point on, I will construct a plan of care in my mind, like what am I going to do for them? So I always treat foundation, just anything that will be good yin support, immune support, emotional support, relaxation, just relaxing the whole body. The muscles will relax, right? You're going to get more chi and blood flow through the body. So that's always my foundational treatment. And then I will go and address pain points because oftentimes I want my patients to walk out the door feeling they had some relief, whether it is 5%, 10%, so sometimes it can be 50%. And that, again, gives them hope that, all right, they can get better. And also and the level of trust in you, they say, oh, she's getting somewhere, right? She know where my pain points are. She knows how to give me some relief. And I'm going to stick with her. I'm going to see how much more she can help me.
Yeah, I think that's so important. Having people feel understood with what they have going on. And for sure, putting your hands on people is such a direct way to let them know that you're listening and that you're attending. I mean, I feel sorry for our colleagues in the Western medicine, pharmaceutical prescribing side of the house because they have to give a medication. That's their job. But we get to put our hands on people.
Yes. Well, that's what I always explain to them. Yeah. Yeah, exactly. That's what I say. That's their job, right? They say, but that's what they do. I said, but that's their expertise, right? That is their job. So we have a role here. So it's not, I think we should all work integratively. I'm happy to refer out sometimes to patients that may need, intervention that way.
What kind of things do you tend to refer out for?
I will refer out for a patient who may need more extensive hands-on physical therapy. So I have a great network. I would refer out to chiropractic treatments as well, because sometimes I feel with soft tissue, I said sometimes you're so stuck there. I feel like you need a really good adjustment. Once that happens, what we have done for you will hold better, right? Instead of the subluxations that's causing. So it's like we keep chasing your pain all over. If necessary, if I feel a patient may need surgical intervention, I will refer them out to a doctor to assess that, maybe therapy. But yeah, I'm very or very good manual massage therapist, like for medical massage. So I'm feel very comfortable referring out.
Yeah. I've got a question about treating people and having them feel better.
Yes.
I have met practitioners who say, oh, yeah, I want to treat them and I want their pain to be gone. Like when they leave my office, it should be zero. And I've met other practitioners that say, I would like to see their pain about 65 or 70% better,
Hmm.
but not more than that.
Okay. Why is that?
And their thinking behind it is, I want to help adjust the body so the body knows what to do and then let the body take care of it from there so they don't become overly dependent on treatment. I'm wondering if you have thoughts on kind of a sweet spot to aim for in terms of pain reduction.
I mean, in general, I would like to get them. I don't think sometimes you could get them to the 100%, right? I think we always get a patient back to the point of 85 to 90% better, and I always explain to them the last 10 to 15% is really hard to get, because that's when you really have to you know already you may have some dysfunction. You have some ligamentous damage, right? I'm not a miracle worker. I'm not going to be able to heal the tendons and ligaments. So then that point is really you protecting your body. Again, we talk going back to working, doing exercises wisely and safely. So if they could get as close to 95% or 98%, but I had a shoulder injury. I know I'm not 100% here, but at the same time, I'm still able to do everything, but I'm very cognizant and aware of my shoulder injury.
So, in some ways, that the injury, the part that's not quite healed, reminds you that you need to be attentive, not overdo it, be aware of your posture, your movement. Sometimes we do injure ourselves
Yes. Absolutely.
in our delight of activity, and being able to sort of titrate our activity is helpful. I want to come back for a moment to your experience of watching kids develop in their movement. I suspect that gives you a whole different sense of what normal movement is versus what abnormal movement or compromised movement is. How much of your work is intuition? How much of your work is hands-on feeling, objective measures?
I think intuition plays a big part into it. I oftentimes say when I'm working with a patient, I have a plan of care in my mind, but I may walk in the room. So as I look at them or talk to them, I say, let me assess the other part, the back part of your body, right? They're like, oh, I was just going to tell you. I said, this, how did you know? I said, I don't know. I just had a feeling that was something that I need to aim to work at, right? So I think a big part of it is also in just reviewing a patient's treatment case, and don't always go about just thinking, oh, if it's shoulder, I'm going to treat face up. Think about the whole body. So that's where my maybe PT standpoint comes in. You want to look at the body in all different planes, right? Especially with joints that are multiplanar joints. So it's not only the front, it could be a lateral muscle group, or there's like posterior channels that you have to work at. So just really looking at the big picture. So it will bring, I guess, have you be more in tune on how better to treat them. So it's the same thing when I was working with children. You see the rolling patterns, going half kneels and coming to extension. And there's so many different ways of playing with them to get them into different movements. So it's this never only just one clear way pathway.
It sounds like you like to have an idea in your mind of what might be going on, but you leave yourself open for what else might be there.
Or whatever the patient presents that day, right? Again, you go back to the basics again of observing and listening. Because you could go into a room with a whole, like you have your whole treatment plan, like, oh, today I'm going to do this and that and that. And then they come in with something else and they present differently. And you're like, oh, wow. Okay, let's pivot. Let's see what we have to do now.
I've got a friend who says his favorite part of doing acupuncture is when he comes across something that he wasn't looking for,
Hmm.
and it makes him change everything about what he thought he was going to do.
Yes. Or sometimes they'll come in and they start telling you about this old injury that you're like, they're like, did I tell you that? You're like, no, that makes a lot of sense, right? You're like, oh, wow. Someone with had a like neck issue, they go, oh, I had a concussion. I have this scar in my head. And you're like, and everything's like, as they start chatting with you, so everything's all that left sided. You're like, wow, like major, channel obstruction problems. So let's fix that and clear that instead.
Yeah. It's funny how it works out, isn't it?
Yes, yes.
How do you think about old injuries versus more recent injuries? Like, for example, the person who suddenly reveals, oh, yeah, I fell off my bicycle. I was age 7. I got a concussion.
Yes, I think you definitely have to attend that. You have to attend old injuries as well. So, you address the acute injury now because that's where they're suffering from. So you want to give them some relief. But again, a big part of it is education and explaining to them why that old injury could have caused that whole chain of dysfunction in their body, why there is always that side, or it could be the opposite side, right? Because your body works in all different movement and planes. So I think the old injury, you have to bring that to their attention and explain to them that might be something that could be contributing to their pain level now.
Wow. Again, I so often think about trying to go directly at a person's problem. And what I'm really taking away here today, Kim, is be open to what else might be there, either unspoken or just offered as an offhand remark.
Yes. Well, going back to I just have a thought as far as we were talking about pediatric movement patterns, right? So at times, sometimes my patients may have certain injuries or how their body has developed, or they keep having recurrent injuries. And then when they're chatting with me, then I may even go back and talk about their milestones, right? Or maybe they did not crawl at a certain time, or they had hearing or visual impairments that could affect them. So their body has developed differently based on that. So their patterns of movement is different and their muscle development became different. So therefore, it could be a lot of imbalances in their muscles, pattern movements, and that could cause current injuries or maybe not being able to do all the things they try to do. So, you know, as I chat with the patients, then I get more and more information. I'm like, oh, and then another light bulb comes off, and you're like, okay, let's talk about that and address that.
And in the end, they end up with a lot more information about themselves and who they are and how they got to where they are.
Yes, and I think that's very important also because sometimes a patient is not, they don't have the best body awareness or kinesthetic awareness, right? They just kind of going through life. And again, I think having all those just movement principles and all the different type of exercises, that's why I always feel it's important for the practitioner themselves to adapt to some kind of movement exercises themselves so they could be more in tune of in their body and they could explain or educate the patients what they are feeling. So it could be anything, right? Between, I study yoga, Pilates, Tai Chi, I exercise, I run. So the more you do, the more you could share with your patients because you can understand it in your own body.
I think that's really true. I've been playing around with this thing called rope flow lately.
Oh, what is that?
Go look it up on the internet. It's literally
Rope flow. Okay, I'm always game to learn something new. Hmm.
it's really cool. I've been playing with it. It's great for some cross body movement and stuff like that. But what it's really done is teach me something about my shoulders that I didn't know about before.
Yeah, you may say, "Oh wow, I didn't realize this one was so much weaker than the other," right? Or I don't have the stability.
Well, or just how the shoulders move, or not move. And exactly as you were saying, as I began increasing my own kinesthetic understanding of my shoulders, I started relating with patients and their shoulder pain or shoulder problems differently because I just had more awareness, period.
Exactly.
So there's a great reason for people to pick some kind of cultivation activity that helps you understand your body better.
True. Absolutely. It's fun. Yes, good for you. It's good for the patient.
Yes. Kim, anything else you'd like to share with us before we wind it down for today?
Oh, I'm happy to share this information of integrative medicine. I think it's very important for people to kind of go outside the box, right? And just gather all the different tools and put in their toolbox and utilize that to help the patient. But definitely very important to just listen, observe the patient, and palpation. I think it gives them more feedback. So not only initially, that's how I would examine the patient, but as I'm working through doing the treatment with the patient and particularly post treatment, I like to go and do a quick reassessment. So after I take all the needles out, I'll go back to the same pain area. So generally, sometimes we want to take the needles out, say, let me know how you feel, see you next time. But I'll go back to the neck pain, the shoulder pain. I'll do a quick range of motion, and that will give them some feedback. They may say, oh, wow, I had so much more movement. Or I may work with the patient and get to a certain point. I'm like, but then it gives me more information. I'm like, okay, we got a little bit more flexion, but you're still lacking in rotations. Then I know what I may need to work on next time. So it's always going back to check in. That's important.
That makes a lot of sense. If people would like to get in touch with you to find out more about what you do or maybe get some help, how do they find you?
Okay. So actually, I'm in flux now. It's a little transition. I just finished up my 24, 23, I always say 24 years and 23 days of practice. I had a practice in Westfield. I finished up and I'm going on a little mini retirement now, but I am still very happy to share information or mentor and help anyone guide them in integrative treatments. So there, I'm going to give you an email and you could just list it in the show notes and they could take a look at that and they could always email me.
That sounds great. I'll put it on the show notes page.
Yes.
Good luck with your future.
Thank you.
Thanks for joining us today.
It was very fun. Thank you so much.
When practitioners reach for a Chai Hu Guizhi Tang or Shaoqing Long Tang, they need quality that they can trust. Lhasa OMS supplies the herbs your clinic needs to be ready for the cold and flu season. Visit Lhasa OMS to source the classical formulas featured in this series. Use the code REMEDY20 for 20% off your next purchase at lhasaoms.com. Some exclusions apply. See the website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.